Hi, Sally Walker here, your hormone and slow age expert. So how can you prevent or how can you push the development of these different disease states, okay? So the first thing on the list that you really want to be doing, people, ladies, is regular checkups, okay? And some of these checkups you can do at home, and they're very, very important that you do this. So you monitor your height. Now, why would you want to monitor your height? Okay, yes, because you'll be maybe losing bone density and you will actually shrink a little bit in height. So monitor that. Monitor your weight and monitor your waist circumference, okay? So you want to know how much fat is building up around your abdomen, because it's going to increase the risk for cardiovascular problems, yeah? So other things that you can do at home is check your blood sugar on a regular basis. Maybe you take a day and do a project with your blood glucose and measure it every 60 minutes to see what's going on. But remember to note down what you did in those 60 minutes. Did you eat something? Did you exercise? Did you go to a meeting? Did you, etc., etc. So you maybe can understand why your blood sugar went up or went down or whatever it did. And the other thing you want to check on a regular basis is your blood pressure. So buy some of these machines. They don't cost very much money, the little blood sugar machines, the blood pressure machines, but you want to know on a regular basis what is happening with these things, okay? And your blood pressure, so the latest numbers are, it should be somewhere between 120 over 80. That's where it should be, underneath that, as much as possible, okay? Yeah. So other things you can do is regular uterine and vaginal checkups, breast checkups as well. So this is all about the cancer things, which could be a problem with some people, yeah, some ladies. The other things that would be good is doing some bone scans. I like ultrasound scanning, which is good, but the mineral density, the DEXA scans are also used. So you want to be doing this. Now, typically, this is not offered to ladies until they're 65 plus, but I do see actually ladies already in their 45 years of age that have low density problems with their bone density. So if there is a family history of osteoporosis, then be sure to use this as your card. Get out of a jail free card when you go to the doctor and say that you would like to have a DEXA scan because your mother, your aunt, whatever, had serious osteoporosis. So you maybe can get it checked a little bit before the age of 65. By the time we get to 65, I think most ladies should expect to be a lower bone density. I'm not going to say osteoporotic, but a lower bone density, obviously, in when they were 20 and 30. Okay, so that would be good. Regular cardiovascular checkups, so all the all the cholesterols and the fats in the blood and all this kind of thing, but also doing some of the scanning. And in the blog, there's an article about CAC, so coronary artery calcium scores, which is possibly the best predictor of a cardiac event within the next 10 years. So have a look at that article because there's some statistics there. And it is not an expensive test to do, but it is not generally something which many doctors are on board with. But please try to get this done because it is a very, very important test to do. Colon checks, so the stool test for bloods, or if there is colon cancer in the family or has been, then doing the colonoscopies is a good thing to do on a regular basis once you get over the age of 60. I believe that every 2 years is probably a good thing to do, but maybe you'll only get every 5 years, but at least you need to get these things checked, yeah? And obviously neurological checks, so the MRI scans, the CT scans, if again, especially if there is some kind of dementia, Alzheimer's in the family or a close relation. So see, these are some of the things that you want to do, you want to know, you want to check all the time. But otherwise, what can you do? Yeah, so one of the things is replace estrogen, okay? So if you are within 10 years of your last menstruation, then you want to start using some kind of estrogen, yeah? Talk with your doctors about it. Talk to a hormone professional, for example, me. Have a half an hour call with me and we'll talk about which possibilities there are. Other things like, well, if you're smoking, you need to stop that because there is nothing good to say about smoking and it really does increase your risk for all kinds of problems, cancers, cardiovascular problems, etc., etc. Reduce alcohol. I'm not saying don't drink. I'm saying reduce it. Ladies, you know, don't do it every day. I think is a really good thing. And then when you do, try to limit to the 1 glass or max 2. But I think the most important message here is not doing it every single day. Make sure you're getting regular exercise, and especially the high intensity strength training type exercises, because it's going to build muscle tissue, but it's also going to help you build bone tissue. So it's going to help with blood sugar regulation. It's going to keep your bones strong, especially, or the studies seem to suggest, only if you're using some kind of estrogen. Yeah. So the diets, there's another video about the diets. So low carb, higher protein, higher fats, those kind of things. And yeah, so if there are some specific diseases in the family, a family history of dementia, family history of colon cancer, breast cancer, heart disease, etc., then you want to make sure you're getting those specific tests done at an earlier time as possible. Okay, good luck, ladies. Happy hormones, happy life.